The housekeeping. If you would be so kind as to not mute your line, I know that's unusual. That's an unusual request. This is going to be a very focused presentation. I'm only going to be speaking for about 30 minutes and then taking your questions. So if I could have your undivided attention for that 30 minutes. No your email box, no typing. Okay, everyone with me?
I think it's not 10 o'clock yet, so we're probably still waiting for folks.
Yeah.
But as long as they can hear us. Is it recording already? Okay.
Yeah. All right, I'm going to do this thing. So I'll meet you at Target.
Yeah.
And 45.
Yeah. Maybe to 8:30. Then we'll have time to like grab a coffee and stuff when we get there.
I'm good.
Okay, yeah. I'm a little worried about everything.
Okay.
I think this is in that building, but.
Yeah, you want me to.
Yeah.
Yeah.
All right. Have a good weekend.
You too.
Bye.
Have some wine.
Okay, it's 10 o'clock, so we're going to be starting the webinar now, and I want to welcome you all to the first Joint Cultural Competency Health Literacy Site Champions meeting among Better Health for Northeastern New York, better known as BennyCare, Adirondack Health Institute, and Alliance for Better Health. I'm Betsy Campisi from Alliance, and we are broadcasting this webinar from the offices of Better Health for Northeastern New York. And I'm here with John Del Grasso, Kendall Pompey, and our presenter today, Susan Ann Malinowski. She's the manager in the Communication Language Access Program at St. Peter's Health Partners. And we're really excited to have her today because she set up a really effective and well-respected in the region language access program at the hospital and for St. Peter's Health Partners in general. And so we would welcome Susan. Thank you very much. Good morning, everyone. I'm going to ask that everyone keep your line open and not be typing and not be answering telephones. Not to be really bossy, but I just want 30 minutes of your undivided attention. I've honed this down so that it's very succinct, and there's lots of information to cover. So I just wanted your undivided attention. So I am Susan Ann Malinowski, and as you all may know, St. Peter's Health Partners is the result of the merging of Seton Health and Northeast Health and St. Peter's Healthcare Services back in 2011. So now we are comprised of 5 acute care facilities, 4 outpatient urgent care locations. We have residential and continuing care, day services, home care, community hospice, and palliative care. We've got primary and specialty care practices, speech, hearing, physical, and occupational therapy services. We are in 6 counties at 180 locations with over 13,000 colleagues. So trying to create something that's going to span all of that was certainly a challenge. I just wanted to talk to you about how we went about building this communication language access. And we called it communication language access because we wanted to incorporate more than just the interpreter and the translation services. We wanted to ensure effective communication for all of our customers and colleagues, regardless if their barrier was a visual impairment or limited English proficiency. So why do we provide communication assistance? Well, the essential, powerful reasoning is that the ability to communicate is crucial to the safety of those in our care. There have been studies that have shown that it reduces readmission rates when we use qualified interpreter services. There was a study done in California that showed that we could realize up to a day-and-a-half length of stay savings on the acute care side. That's a lot of money. It improves patient compliance, and I think very importantly, it reduces the anxiety, not only for the consumer, but also for our frontline employees. Nothing more scary than trying to take care of someone who you can't communicate with in front of you. So we are also, of course, motivated to be compliant with the law. And the law requires those medical providers who accept federal Medicaid and Medicare to provide effective communication to those with limited English at no cost to the consumer. And as you can see here, these laws have been on the books for a long time, 64, 73, ADA, and 90, and most recently the Affordable Care Act. And even more recently than that, the advent of 1557, the final ruling of the Affordable Care Act, but we'll talk about that in a little bit. So when we talk about the law, we talk about the reasons why we need to be compliant. There are financial pitfalls. A recent suit in January of this year, the Health and Human Services and U.S. Attorney's Office of Connecticut regarding UConn Health. They filed against them, and now UConn has to assign a civil rights coordinator. They have to revise their policies and procedures. They have to implement tracking for all of their interpretation requests. They have to do mandatory training for all of their staff, and oh yeah, there was $20,000 compensatory damage for the complainant. So there are certainly those things to be considered as well. So when we started this journey back in February of 2009, we looked for all the support that we could find. And we also know that this is a journey that we will continue always. The truth is that we will never stop learning and improving our plan because the technology is going to change and the laws are going to change and societal norms will change and we're going to need to change with them. We dove into the class standards, culturally and linguistically appropriate services in health and health care. Just an excellent guide for what best practice is from some of the best minds in the field. And our other lifeline was the roadmap, advancing effective communication, cultural competence, patient and family care. That's what the that's what the class standards like, and that's the roadmap for the hospitals. If you do not have a dedicated resource for heading up this initiative in your entity, you're going to need to make the case, like we had to, that we are doing nothing but getting more diverse in this area, that the regulatory oversight is increasing, that the management requirements are just off the charts. There's a need for systems development, for coordination, for education. Having a dedicated resource to spearhead all of these things is really essential. So I think the first thing that you need to think about is who are you serving? Who's coming for treatment? And how many of those sorts of folks are you seeing? Are you able to get reports from your electronic medical records?
Is your registration staff, are they asking the right questions? Are those questions being documented appropriately? So who in the community can you ask for help to answer some of these questions? Well, you can go to schools. We went to our refugee organizations, the United States Committee for Refugees and Immigrants, USCRI. We went to advocacy groups like Northeastern Association of the Blind at Albany. We reached out to support organizations like the Independent Living Center of Hudson Valley. Building relationships with the other stakeholders in the community was really essential for us. And I know that when I have a question about something, I can go to them, my experts, and we collaborate all the time. And teamwork really is going to be essential, and not just, you know, collaborating with the community members, but teamwork within your entity. This program is really going to touch everyone. And in no particular order here, each part of our organization really have a role to play. Assuring effective communication is going to impact registration and clinical staff. So now you're going to have to ask your registration folks to ask each and every patient and caregiver, what language do you prefer to use when discussing your health care? And then they need to document that answer in the patient's medical record. And then that information needs to be shared with the rest of the care team. And the care team needs to know what resources they have available to help them, how to use them, and why it's required. Can everyone hear me? Okay. So this is going to be commitment to ongoing education.
Excuse me, who's ever busy at their desk, can you please pay attention and stop typing? Thank you.
Sorry. You also need to think about how HR is collecting data on your colleagues. That's important to ensure federal law compliance. When I talked about 1557 before, the final decision came down and it very clearly stated that if you have a bilingual staff member, you need to be able to prove that they language. You need demonstrable proof. So how is HR collecting that data so that you can make sure that those folks are getting screened appropriately? Risk and legal can be your partners in supporting that sort of compliance. Certainly you want to engage with patient relations, because if your limited English proficient customers have complaints, they're going to be going there, and you need to make sure that they've got resources to be able to communicate. Federal compliance also involves your websites and your brochures and signage. These are all typically under the purview of marketing and corporate communications, so partnering with them is going to be important as well. Making sure that someone is sitting at the table for all of these different things is a real challenge. So the tools that you will be offering your colleagues to be able to communicate, there's many options. Over-the-phone interpretation, OPI, is available 24 hours a day. Most of the vendors have 200 languages and dialects available. The typical connect time is 15 to 20 seconds. It's really, it's a very efficient way of getting an interpreter. Sometimes, though, OPI isn't going to be your best solution to the problem. Sometimes you're really going to need to have eyes on. Or if your patient is deaf and uses American Sign Language, the phone definitely is not going to work for them. So we have other options. We've got video remote interpretation. So there are several different vendors that we work with that have multiple languages, not just American Sign Language. And not just American Sign Language, but certified deaf interpreter teams, which is excellent. An added benefit when you're trying to communicate with someone who has decreasing language skills. There's also in-person on-site interpretation. And this is particularly helpful when you've got cultural brokerage that needs to happen. If you need to be able to really communicate with someone who has an experience that is so foreign to where we are in our Western medicine, having an in-person on-site interpreter can really help bridge that and reassure that customer and reduce their anxiety. But you need to think about other things. So what's your technical capacity? Do you have wireless in all of your facilities? Do you have analog lines? Most buildings that have been built recently only have digital lines. And the equipment that's available from some of the vendors rely on analog lines. So that's something to be thinking about. You really are going to need to partner with your IT folks. And then you need to think about, so we have these resources, how are people going to request services? You're going to need to create processes. You need to be a central point of contact, and you need to have redundancy. At St. Peter's Health Partners, we have 3 different vendors that we use for OBI. We have 3 different vendors that we use for BRI. And we do that because we know, as everyone is aware of the recent devastation in Florida and Texas and Louisiana, there are places that will lose power. And what would happen if one of our call centers was located there? Well, we partner with many different vendors who have call centers all throughout the United States, so that isn't an issue. And then, of course, there's translation. What do you need to have translated? And where will it be kept? Who's going to keep track of it? Who's going to make sure that all of these tools are user-friendly so that your staff will actually use them? These are all excellent questions. The next thing I want to talk about are your bilingual providers. I talked a little bit about this before. ACA's 1557 final ruling was very specific when they talked about bilingual providers. How are you going to make sure that your doctors, your physicians, who have another language are screened? How are you going to make sure that they are deemed competent so that they are compliant with the law? Who are you going to partner with to have that competency done? The vendor that we use at St. Peter's Health Partners offers different screening tools.
I'm sorry, we just received something in the text box. I'm going to mute the lines real quick because there's some interference. Sorry, we're trying to make sure that
That interference isn't with us any longer. I think we're okay for right now. All right. Making sure that your bilingual staff have been screened appropriately, and making sure that they understand that what that means is that they're able to perform within the scope of their role, and that they're not interpreters. People have this notion that if you're bilingual, then you have the skills to be an interpreter, and that just is not so. A qualified interpreter has extensive a qualified interpreter has extensive training. They are following a strict code of ethics. They have the specialized vocabulary that's necessary for that encounter. So think about it this way. If you were to go into a medical appointment, there are words in English that you understand, and then there will be words and concepts that pertain to the medical field that you will not understand. Well, they're in English, but you're not going to understand them. So in the same way that we wouldn't want someone who has 3 years of high school English taking care of our English-speaking patients, we want to make sure that whoever is using their second or more languages is completely fluent and able to work within the scope of their role. That's why having HR incorporate the question during their onboarding process, are you bilingual? Do you wish to use your second or more language at work with our customers? Why that's so important. And we're trying to incorporate regular screening into the credentialing process. So just like with every other medical provider goes through the credentialing process every 3 years, this would be part of that. Just to make sure that everything is kept in all in one place so we know who and who is not appropriately using the languages. So putting it all together, this really is about having oversight. This is really about having someone who's in a position to be able to see all of the moving targets. It's about patient safety. It's about managing the resources, the equipment, the vendors, the independent contractors, the billing, the education, the library, making sure that you're ready for surveys. Having a dedicated resource to be able to put their finger on the pulse of all of this really is invaluable. Making a case to leadership to be able to dedicate funds to this resource is really, really important. So at this point, I'm ready for questions.
Thank you, Susan. That was really helpful, and I think it's a really good base for people who haven't set up their language access program yet. And I just have the first question, and then we'll let other people go. What was your biggest challenges? What are some of your biggest challenges in this language access program?
When we first started, Keith, Venus, and I, we were really working just for one facility. So it was just St. Peter's Hospital and all of their outpatient locations. And now it is St. Peter's Health Partners. So one of my biggest challenges is just the sheer size of it all. And the fact that we have one dedicated resource, for which I'm very grateful that leadership saw that that was a smart and timely thing to do, and I have a part-time assistant, it's still an awful lot. It's an awful lot for just one person. And when usage just keeps doubling, so every year the usage for our OPI and our BRI and our in-person on-site interpreter requests that are coming through keep doubling. So you can imagine that it's a lot of work. But there's the challenge. Does anyone have any questions?
Yes, I do. My name is Carrie Allen. I'm from a hospital in northern New York. When you say an on-site interpreter, we have a fairly decent language access and communication program here at our hospital, but that's the one area that we really struggle with. We have the over-the-phone interpretation, and I'm aware that, some patients do really prefer that in-person ability. We live in an area with several colleges, and some of those colleges attract students from China, from India, but then we also have a migrant worker population, and obviously they speak Spanish. So in trying to look at having an on-site interpreter available, do you just have one that is kind of the largest primary language used, or do you have several that speak different languages?
So the difference in methods of providing services is actually something that there was recently a lawsuit that was brought. It really is one size does not fit all. And I know that there are some people who are really challenged by their locale. I have a colleague who is down in Cape Cod, and it's very difficult for her to get certain languages, in-person on-site languages there, so I feel for you. I think what we do is we have all of the tools, and then we really try to guide the clinician to find what's going to be best. I think most people would say, gee, I bet in-person on-site is the very best solution to the problem. But you'd be surprised that sometimes culture, that's not what the person wants. We have a in-person on-site interpreter agency that we contract with. They offer 23 languages at this point. And we are always trying to get more. I would love to have Vietnamese. I would love to have Karenni. But there are just some languages where it's really difficult. That's why having something like a video remote interpretation, if you have the technology and it works properly, that can really be a godsend.
Yes, thank you. And we do. We have the video and we have the over-the-phone interpretation, and we ramped up our wireless throughout our entire system to make sure that those systems would work flawlessly regardless of their locale. Would you mind sharing the name of that in-person agency that you use?
I don't mind doing that at all. I'll do it offline.
Okay.
Carrie, I will send you an email with that information. I know that they are specific to the Capital District, but they might be able to help you get in touch with folks who are closer to your area.
Wonderful. Thank you so much.
You're welcome. Thanks for the question. Anybody else?
All right, I have another question. I know in this local area, some of the providers are very hesitant to provide interpreters because of billing questions. So I was wondering if you could just tell us what your experience is and give people some hope for being able to bill.
Well, if it's hope that you're looking for, I'm afraid I have not a whole lot to offer. If your consumer is a Medicaid patient, you do have a way to bill for at least a portion of the services that, the language access services that you provide. I know that my finance people just thought that the amount of reward for all the effort to put those systems in place really didn't make it worthwhile. But I really wanted to encourage us to do that just simply because I was under the impression that eventually commercial insurers would also reimburse for these services. Now, considering the state of healthcare, it's anyone's guess what's going to happen. But it is, you know, the cost of doing business. It is something that you're required to do. And the benefits really, I think the benefits really outweigh what the costs may be.
Yeah, in terms of compliance and patient safety.
And patient safety, and, you know, we'll hear anecdotally about, you know, the doctor who didn't want to, you know, take the time to use that interpreter service. He didn't want to take the time to access that telephone, that OPI, that BRI service. And all I could say to him was, when you're not doing that, you're practicing veterinary medicine. And your patients deserve better. Does anyone else have anything? Keith, I noticed that you were out there. Do you have anything that you'd like to add about what we did and how we did it?
Yeah, one of the great things was that as we went through, you will find different allies in different locations. We had a plethora of individuals that joined in our journey throughout the process. Wilma Alvarado Little was a great resource. She was able to tap in and help us out in a variety of ways and connect us and have us think about different things that we hadn't thought about. We had internal experts, different individuals that could speak so many different languages. It was just amazing. We were able to work at a national level. We were working with our parent health system at the time, and we're able to get key individuals. We went to different locations to see what they did. Not to say that we were going to do exactly the same thing they did, but we learned a lot from that. So it was a long journey before we got the plan together, but our main questions were, how do we do this everywhere at any time and then make it as user-friendly as possible? So that was some of the things that, in reflecting back on it, we went through that process.
Thank you. Yeah, I have to say that Wilma Alvarado Little is our guru. She can't possibly be thanked enough for the guidance and support that she gave us. One of the other questions that came in was, please share a bit about providing services for the deaf community in order to be compliant with the ADA. At St. Peter's Health Partners, in the Capital District, we have independent contractors, independent American Sign Language folks, interpreters that we work with. Because there are so few, because it is a finite resource, it really is challenging to make sure that everyone has what they need when they need it. But I think that our deaf community really appreciates the fact that there is a finite resource there, and they're pretty flexible. Again, this is another time when technology can be your friend, but I'll also warn you that technology isn't the end-all, be-all, and there are times when you simply have to have that in-person, on-site interpreter there. If you've got a ASL user who has visual impairment, the VRI is not going to be a good solution for them. So you just really need to take it on a case-by-case basis. We've partnered with a team, well, we created a team of independent contractors, and really it's been very gratifying to work with them. There's a lot of hoops that they have to jump through in order to participate, and it's time-intensive on my part because I'm not just working with one agency, I'm working with a bunch of individuals. So that's challenging. But in the end, you know, they are there to provide for the community, and that's really, you know, everyone has their eye on the prize. Everyone has the goal, same goal in common. So that's very helpful. Anybody else?
Yes, this is Carrie Allen again. I was wondering, did you form any sort of an interdisciplinary committee around this to maybe help involve those that weren't dedicated to it to be more aware of what you were trying to implement to get buy-in?
Yeah, so when we initially were writing the policy, we had to go to everyone, and I mean everyone. We met with everyone to talk about how this was going to impact them, because everyone has special needs. Every facility that we were talking about was a little bit different. What does a physical therapist do? What does behavioral health do? How does this impact them? So we really ran it through everyone to make sure that everyone was understanding what it was that we were trying to do, and that was our initial way to buy in. And we do orientation every Monday for our incoming St. Peter's Health Partners colleagues. And everyone gets that. I do a 15-minute presentation there every Monday for all the new staff. And I also follow it up with an email that recaps everything that I talked about and gives them some great resources. I do in-services on a regular basis, and a reminder about what this is and what it's all about and being compliant and how to do that is also included on our annual update, which is mandatory for staff. So it's an ongoing process to make sure that, number one, people know that the resources are there, that they're educated how to use the resources, and yeah, I definitely try to keep in touch with management and leadership to make sure that they understand the importance of folks actually utilizing the services.
Wonderful. Thank you very much.
You're welcome, Terry. Anybody else?
All right, I have another question. I know a lot of the times providers would like family members to just step in and help out at disappointment, and I was wondering if you could share with the group, you know, what their problems are with that.
The path of least resistance. So in our policy, it is strictly forbidden to use family members, friends, or untrained staff as medical interpreters. That being said, people can decline the services, just like they can decline to take that medication or to take that test. People can say, I don't want to use your interpreter. And if they do that, they need to complete a declination form. And on that declination form, it clearly states that that interpreter isn't just there for you, the patient. They're there for the provider, too. And I give my colleagues a script that says, I understand that your mom wants you to help us talk, and that's fine. You can do that. We still need to engage our qualified medical interpreter, and we're going to have them just stand by and listen in case we need any support with the medical terminology, because it's very important that everyone understands exactly what's happening in this room. We need to make sure that we have the interpreter involved, because what an interpreter is doing versus someone who's just bilingual, who's participating, it's the interpreter's job to convey word for word, meaning for meaning, without error or omission from one language to another. It's a really hard job. And they have all that specialized language. Like I said before, when you go into a medical appointment, that medical provider is speaking English to you, but that doesn't necessarily mean that you're understanding what they're saying. So having that professional there to be able to take into consideration literacy level, the range, the triad, the whole room, and making sure that everyone's understanding each other. That's really important. I usually tell folks, you know how when you're daughter is telling you should drink more water, and you're like, yeah, I should drink more water. If you're using that daughter as an interpreter, and the doctor is telling you should really drink more water, you're still only hearing your daughter tell you need to drink more water. So it can change the authority of the information that you're getting if you're using someone who is not a qualified interpreter.
Well, I wanted to respond to that. That's a really interesting point, and what we were hearing in some of our listening sessions is that also the family member who has to do the interpreting feels a very big burden, and sometimes they have to miss school or work, and they feel a burden about worrying about their family member that they wouldn't necessarily have had if they hadn't had to be the interpreter.
Or having to convey terrible information. I'm so sorry, to tell you you've got cancer. Who wants to tell their parent that, or their family member that, or their friend that?
And do a lot of damage.
It can absolutely.
Contentment, yeah.
Absolutely. So you need to think about all that stuff, and we don't know what their background is, what their history is, So better to have that qualified interpreter there who can really facilitate that communication, and just to make sure that everyone's all on the same page. Anybody else?
Well, I have another question.
You're good. Okay.
The other thing that we were hearing in our listening sessions had to do with mental health providers not wanting to do the sessions because they feel the interpreter interferes with the session. They didn't want an interpreter. So could you address that issue with any behavioral health provider who might be listening to this?
I have to say that I think it's just a matter of education. The interpreter is an essential part of the care team. You can't do your job safely without them. And what they will always strive to do is to be invisible. It is not their job to be a barrier, but instead to be a conduit. If you ever worked with an interpreter, you'll notice that when you're working with oral languages, they won't make eye contact, because what they want is for the provider to make eye contact with the customer to make eye contact with the provider so that they understand where the conversation is coming from. And they really want to be in the background just facilitating. That's their number one job, is to make sure that that communication is happening effectively. So I think it's just really a matter of education and understanding really what the role is, maybe sharing what the code of ethics are that an interpreter has to follow. I think maybe that might be helpful for them to understand a little bit more about the training that they receive. A lot of these interpreters, this is not a road to fortune. This is really a labor of love and a passion for wanting to be supportive of one's community. They are professionals who really know that they are a part of the care team and want to help facilitate. So I try to remind my staff all the time that before they start that encounter with that interpreter, give them that debrief. Give them the report. This is especially valuable when we're talking about an OPI, an over-the-phone interpreter, because not only are they coming in blind, but they're coming in cold. I mean, they don't know anything. You could say, I'm here with my patient, Susan Malinowski. She's a 51-year-old woman who is presenting with left quadrant pain. It's going to give that interpreter some place to start, some idea of what sort of vocabulary they're going to need. So really, I encourage there to be that collaboration prior and following an encounter too, to be able to say, talk prior to the encounter about what goals you have. I'm really concerned about this and this, and she has this diagnosis, and these are the things that we want to talk about today. That will really help the encounter be more successful. And you certainly are welcome to debrief as well afterwards, saying, I thought that encounter went well, or it didn't went well, or what did you feel about how they were absorbing that news? Again, they are a team member. So I encourage people to treat them as such. And I'm happy to share the code of ethics that, that our interpreters abide by, and the sorts of training requirements that they have. So thank you for that.
So is there any training available for people who do feel insecure about using interpreters?
I have on the email that I send out post in-service, there's a tip sheet on how to work with interpreters. There's a couple really great websites that, especially when we're talking about ASL interpretation, because that can be a little bit different. There are different resources out there that can acquaint you with how that all works, what you should be doing and how you should be. I'm happy to share any of that information as well.
Okay, thank you. Do you have off the top of your head a website people can go to?
There is a great resource that I use. I get emails from them all the time, and on their emails they've got all of these different sites. I'm going to try to peek at this and see if I can't find something recent that have little videos, and some of them are specific for the interpreters, but some are specific for the end users, and I'm going to say, no, I can't bring that up.
It's not Think Cultural Health.
Cultural Health is one of them.
Think Cultural Health is a good website.
Yeah, Think Cultural Health really is a really great resource. And, you know, God love Google. All you really need to do is to type something in there, and I'm going to tell you, 9 times out of 10, you're going to be able to find at least the start to the answer to your question. Does anybody have anything else? No? Look at that, it gets you 15 minutes back to your day.
I'm sorry, this is Kendalls Focus. Just real quick, I just wanted to add, hold on, looks like another question just popped up.
Oh, Wilma. Yes, thank you very much, my friend. So it is important to stress that you should never, ever be using minors to interpret. You shouldn't be using family members or friends to interpret, okay? But you most certainly should not be using minors to interpret. Don't ever put a child in that sort of a situation. There are too many resources available to you to ever have to use that as an excuse. So, yes, please do not use minors.
Thank you, Susan. So I just wanted to add one last piece before we go. Again, another housekeeping piece. For some reason, we had a slide that didn't upload, just to basically say to track attendance, and this is for Benny. I'm speaking for the Benny Network, folks who joined us today. If you could please send us an email at district.mail.edu, or AMC, mail, I'm sorry, let me start from the beginning. district@mail.amc.edu. Just basically saying CC Champion in the subject line, and just that you participated. We'd appreciate that. And I'll send something out to you also, just as a reminder. But if you could do that, that would be great. That way we can make sure we track your attendance and that you participated.
And if we get that information, we get email addresses, I would be happy to email the group those resources that I talked about.
Okay. Thank you.
So even if you're AHI or Alliance, please also email that address so we can send you those resources.
Just another reminder, everyone loves their technology, and I know I certainly do, but one of the admonishments that I give to all of our staff is not to use any sort of translation or interpretation app. There may be an app for that, but they are notoriously faulty, so it is our policy to forbid those sorts of things. Be sure not to use, and you will encounter customers who are comfortable using that, but it really shouldn't be used in a medical situation. That's my last note.
Okay. Thank you so much, Susan. We really appreciate your time and this really helpful presentation. And just open it up for if you have any other questions, this is your last chance. Otherwise, thank you very much. Thank you to all our site champions who attended, and we will be in touch.
Thank you.